Yes, can you see the screen? Manogna speaker. Okay, thank you. So, guys, now we are going to discuss most important topic, prescription. Define prescription. Can anybody define prescription, please? Fast. You will definitely have few questions from the prescription. So, what is prescription? Prescription is a written order from a physician to a pharmacist or from a medical practitioner to a pharmacist. What does it contain? It contains the information about the prescribing drugs, right? Their quantities, right? Their strengths, how to use it, instructions to the patient, instruction to the pharmacist, how to compound it, refilling instructions, and many other parts are there. So we will see what is the prescription today. We will see parts of prescription today. We will see errors in the prescription today. We will see, if possible, how to handle the prescription today. So all these are very, very, very important. If possible, if in this class or in next class, we will see some Latin terms also, which are very, very essential to understand the prescription. Okay, so you can see clearly here, prescription is a legal document. It's an order written by a qualified healthcare practitioner or a doctor or a physician, right? And it is written to the licensed practitioner, written by a licensed practitioner to a pharmacist. Okay, so that's the important definition. You should remember what is prescription. In every prescription, we see this highlighted part. You can see RX, we generally write. So RX, what is RX? We should see while discussing parts also. RX is called as recipe. RX is an indication to say to be taken. So whatever drugs written after RX, it means to the pharmacist, it's assigned to the pharmacist that these to be dispensed or these to be given to the patient, right? And it is also prayer to the Greek god, prayer to the healing god that heal this patient with these drugs as soon as possible. So that's also very important. Types of prescriptions you can. There are two types of prescription: private prescription form. Next one is National Health Service prescription form. In private prescription, this type of prescription generally written on a form that includes name, that includes address, qualification, and of the prescriber, RX, inscription, subscription, and even superscription. Whereas NHS prescription form, look, you will have it will be issued by the NHS patients suffering from certain diseases, and it is issued with the government prescribers. So for example, మీరు ఎంజిఎం పోయినట్టుంటే అండి మన జనరల్ ప్రిస్క్రిప్షన్ లాగా ఉండదు. ఒక రిటర్న్ ఫార్మెట్ ఉంటుంది. పీపుల్ హూ హ్యావ్ విజిటెడ్ ఎంజిఎం దే నో. ప్రింటెడ్ మీ సేవా చిట్టి లాగిస్తాడు. దాంట్లో మొత్తం డీటెయిల్స్ అవన్నీ పేషెంట్ నెంబర్ ఎవ్రీథింగ్ విల్ బి రిటర్న్, అండ్ బ్యాక్ సైడ్ ఆఫ్ దట్ ద డాక్టర్స్ విల్ రైట్ ద ప్రిస్క్రిప్షన్. సో గవర్నమెంట్ ప్రిస్క్రిప్షన్స్, గవర్నమెంట్ హాస్పిటల్స్ లో, గవర్నమెంట్ PHCs లో the prescription is some sort of different when compared to the private doctors given prescription. Private prescription is something like a letterhead of a doctor in which the details of all that particular doctor, his license, his qualification, his address, phone number, date, and other parts are given. But in government prescriptions kept by the government and government hospitals, details of the doctor are not given. Details of the hospital and details of the patient are given. So, these are different types of prescription you should see. Luckily, if you get job like as a pharmacist and if you are placed in the government hospitals, then you will see the difference between the government prescription and the general prescription. Vitamin prescriptions and government prescriptions. Okay. Now, coming to the very, very, very important part of today's discussion, parts of prescription. Chalo. So, everybody of you know the parts of prescription. Please let me know one by one. What are the important parts and what is their important? What happen if you don't add these parts, right? And other things, right? First thing, every prescription should have date. Date is the very, very, very important part of the prescription because a pharmacist should know when this kind of drugs are being prescribed. So it is 1 month back prescription, 1 week back prescription, prescription, today's prescription, 1 2 years back prescription, he should know it, and he should carefully dispense the drugs depending on the date. So date on the prescription is very, very, very important. If a pharmacist sees the date, don't see the date, he should immediately ask to add the date, because it can cause certain problems if you don't mention the date. Many times the prescription is not supposed to be refilled. If you have a date, then you will understand whether to refill or not. Especially when you become a government pharmacist, lot of discrepancies, lot of issues are going to happen there. So without date, you will be caught. So you should be careful, right? While by checking that whether the date on the prescription is there or not. Next, very important part is the patient information. Patient information, what should be given, name of the patient, right? Then you should write age of the patient. That's also very important. You should mention very good gender of the patient is also very, very important. Even weight of the patient is important if possible. And certain situations low, even the blood pressure, BP of the patient should be noted down. So the basic information of the patient are noted along with the name, gender, age, weight of the patient, and blood pressure. In many instances, you should also ask about their physical situation, like whether they are carrying or not. Right? That's also very important. I'll show you the reasons why. Then whether they are feeding their babies, is that case or not? So, and whether if the patient is a woman, even in some cases the doctor should know whether she is on menstrual cycles or not, because there are a lot of drugs which are going to affect these situations. So these personal information of the patient should be especially given on the prescription. Let's see one by one reason why name is important. Right? If the same 2 3 people in the house is having the same problem, right? Taking prescription with this is common practice, right, in our country. Right? Taking prescriptions on the name of the one patient, everybody in the home are using the same thing. Viral fever season just recently gone. Everybody, अरे अबे amoxicillin मत करा, अरे cefixime मत करा, अरे taxine मत करा, अरे doxycycline मत करा, अरे Dolo 650 वाడుకుందాం అయిపోతుంది. That should not be the case, because every patient's conditions are different. Age ni batti, gender ni batti, right? Their weight ni batti, their physical condition ni batti kuda lot of doses and drugs will change. So to avoid this thing, the prescription on the prescription, the pharmacist should check the name of the patient, and they should thoroughly ask whether these drugs, what they're taking, is for themselves or somebody else. Right? In order to avoid the misuse of the drugs, you can use this. Next, age. Why age of the patient is important? Because dose changes depending on the age. Right? Every patient, we are not giving to give the same dose of the drug. Pediatric
Yes,
doses are
sir.
different, neonat doses are different, geriatric doses are different. So, in order to know that thing, we need to mention the age, especially two organs in the body. The liver and the kidney are not well developed in children, and they are destroyed or not functioning well in the old age geriatric patients due to wear and tear. And these two organs are very, very important. Why? Liver is important for metabolism of the drug, and kidneys are important for the elimination of the drug. If the liver is not well developed in the children, then metabolism is affected, right? So if metabolism is affected, what's going to happen? If the metabolism is affected, what's going to happen? If metabolism is slowed down, what will happen? Then other kinetic parameters will also be affected, like elimination,
Distribution.
right?
Drug will
Because
not be.
yes, because only deactivated drug will be eliminated. So even metabolism is slowed down, drug accumulation will start, right? Which can lead to drug toxicities. So all these problems are also there. So you should be careful about the health of the liver and kidney. Liver's health is very, very important for any kind of drug to be given to the patient because 90%, in fact, 99% of the drugs are being metabolized, biotransformed, deactivated using hepatic enzymes, right? So, in order to right it was in order to overcome these issues we should be aware that liver is well developed. So in children liver is not well developed, so doses are being compromised, doses are being reduced, and in geriatric patients his liver can be maybe like affected because of the disease conditions, because of many other issues, age related things. So second thing is kidneys. Kidneys are very, very essential for the drug elimination, and as you know, kidney is not the only way to eliminate the drug. There are many other ways to eliminate the drug. There can be non-renal elimination. Drug can be eliminated through lacrimal secretions. Drug can be eliminated through sweat. Drug can be eliminated through saliva. Drug can be eliminated through bile, and drug can be eliminated through many ways. But the major portion of the drug is eliminated through kidneys. If the kidney of the patient is not well developed in pediatrics, or it is facing certain problems like in ESRDs, end stage renal diseases, or in the case of like dialysis patients, or in the case of nephrotoxic patients, or in the case of renal calculi, and many other issues, what's happening if kidney is not good, then drug is not going to be eliminated. So, in order to overcome this two, you should clearly mention the age. Depending on the age, a pharmacist can just guess what is the age of the patient and the drug given is correct or not. So you shouldn't forget the age. Next, gender and gender is a very, very, very important part in the prescription. Why gender is important? All the drugs are same kada, girls, boys equal kada anukokurdu. There are a lot of like I have given you 3 points here that why gender should be should be asked. Maybe the patient is carrying, maybe the patient is feeding, I mean feeding baby, or maybe the patient is on the menstrual cycle. In such instances, certain drugs should be avoided. Very, very important part, right? I hope you know what is there are certain drugs which which are going to going to pass blood placental barrier and going to affect the child in the womb. And such kind of drugs are called, such kind of substances are called teratogens. And I hope you know about the teratogenicity. So in teratogenicity, what's going to happen? In teratogenicity, basically the drugs which are given to the patient are bypassing the first part of sorry, bypassing the placental barrier,
Plasma.
blood placental barrier. Yeah, and it is going to affect the children. So, in order to overcome that, we should be careful. A beautiful example of thalidomide, everybody know it. What happened when an anti-emetic drug, yeah, anti-emetic drug is given, right? How 3 million women, right, children burning from, right, giving birth, 3 million children are
Without
without hind limbs, right? So all these things we know very well. So we should be careful, and the patient doctor should find out whether the woman is carrying. Doctor patient should know. Pharmacist should know before prescribing the drug. Next, feeding woman related problem. There are many drugs which can be extracted from the milk. Lacrimal secretion జరుగుతుంది, right? So mammary secretion జరుగుతుంది. So in that cases, drug can affect the children, especially CNS depressant drugs కావచ్చు, habit forming drugs కావచ్చు, many other drugs should be avoided. Even in many cases, like especially in the menstrual periods and in feeding babies, if we are going to give H1 and H2 receptor antagonist, then it is going to affect the milk production. So in that cases, it's going to be again complication. So gender should be an important part of the prescription. Not only name of the patient, age of the patient, but gender of the patient is also very, very, very important. We will discuss in posology some other reasons also why women should be specifically mentioned or the gender should be specifically mentioned. Next very important part of the prescription is weight of the patient. So what is important in the weight of the patient? Because generally the normal healthy individual weights will be 50 to 70 kgs. Below that will be the lean patient. Above that will be depending on other factors will be the obese patient. So in obesic patients, we can't give the same dose of the drug. Same the case in the lean patients also. So body weight is important to calculate the dose of the patient. We have dosage calculation. There will see in clear about all these things. So all these personal information of the patient should be included as a parts of prescription. Okay, so noted. Even blood pressure should be noted because doctor should know or the pharmacist should know the what is the general condition here, and known cases of the diabetic, known cases of hypertension, no case of any previously known disease is there, then it should be also nowadays mentioned on the modern prescriptions. Clear, guys? Yeah. So next we are going to discuss about the next part of the prescription, that is superscription. So these three are very important parts: superscription, inscription, and subscription. So these three parts are, we can say, the heart of the prescription. So these parts will become the main core of the prescription. Why? What is there in it? We are going to see. Okay, so superscription అంటే ఏంటన్నా? Superscription is very simple. It's an RX, what we just described. Right? RX is generally it's a Greek letter. It's also called as recipe. It means to be taken. It is instruction to the pharmacist that below this RX all are given drugs or the ingredients which are supposed to be given to the patient. So RX is the superscription. It is a prayer to the Greek god. It's prayer to the healing god also, that that request to that healing god that this patient should recover soon. Then the important part comes, that is inscription. Inscription అంటే ఏంటండి? Inscription లో you have ingredients, you have the quantities, you have the type of the drug to be taken, right? To be mixed. For example, if you are preparing a paracetamol tablet, how much starch should be taken as a diluent? How much MCC could be taken as a disintegrant? How much paracetamol should be taken as an API? How much talc should be used? How much guidance should be used? How much lubricant should be used? What should be used as a binding agent? All these ingredients to be taken, quantities to be taken, are generally part of inscription. Nowadays, inscription, modern prescription law, we are not preparing proprietary prescriptions. We will have the already preparations. So the more part of the modern prescription will be the names of the drugs doctor writing, right? Right. So that comes under the part of the prescription, and strength of the drug. Right, 500 mg paracetamol తీసుకోమంటున్నాడా, 650 mg తీసుకోమంటున్నాడా, 1000 mg మనకు లెనోలియార్ అని వస్తుంది, ఎక్స్టెండెడ్ రిలీజ్ పారాసెటమాల్ తీసుకోమంటున్నాడా. సో దట్ కమ్స్ అండర్ ఇన్స్క్రిప్షన్. దెన్ నెక్స్ట్ వెరీ ఇంపార్టెంట్ పార్ట్, super subscription. What does subscription contain? Subscription contains the instruction to the pharmacist. Like, for example, we write Fiat Mixtura, mix it well. Instructions given to the pharmacist. See, I'm showing you. Subscription contain instructions to the pharmacist. How to handle this chemicals, how to dispense this chemicals, how to prepare this formulation. Generally, మన ల్యాబ్ లో ప్రిపరేషన్ మెథడ్ ఇస్తారు కదా. మనం సింపుల్ సిరప్ ప్రిపేర్ చేస్తున్నాం అనుకోండి. ఫస్ట్ take 66.7 grams of sugar, then add water in it, then mix it gently. It's not dissolving. You add excess amount of heat in it, then it will dissolve. Right after that, how much coloring agent should be added, how much flavoring agent should be added. So entire procedure is given. So procedure given in your experiment comes under superscription, right? And these are the instructions to the pharmacist how to prepare the formulation. So మరి మోడర్న్ ప్రిస్క్రిప్షన్ లో ఇన్స్ట్రక్షన్ టు ద ఫార్మసిస్ట్ ఎలా ఇస్తామండి? ఎంత డోస్ ఇవ్వాలి, ఎంత స్ట్రెంత్ ఇవ్వాలి, that is the instruction to the pharmacist. Right. For example, there are many drugs with many doses and dosage forms. If the instruction is not given to the pharmacist, then it will be problematic. Example, take an antifungal drug. I always give this example only because I have seen errors happening in this example. Ketoconazole. Good to know, Manavna?
Sir,
Ketoconazole example. Right? Why ketoconazole example? It's an antifungal drug. Right? In this
yes,
antifungal drug, this drug is available as shampoo, as powder,
powder.
as Yeah,
Yes.
as ointments, as creams, as tablets, right? So many formulations ketoconazole is available. You went to the dermatologist with a complaint of the fungal infection. Doctor wrote just ketoconazole, finished. He didn't mention what is the dosage form. Then what as a pharmacist you are supposed to do? ఏది అవైలబుల్ ఉందో, ఏది సేల్ అయితే లేదో, ఏది చాలా రోజులు పక్కన పెట్టుందో అది ఇస్తారా? You should refer back the prescription to the pharmacist, to the physician, mention the dosage form. Sir, నేను టాబ్లెట్ ఇవ్వాలా, క్యాప్సూల్ ఇవ్వాలా, ఆయింట్మెంట్ ఇవ్వాలా, షాంపూ ఇవ్వాలా, సోప్ ఇవ్వాలా, పౌడర్ ఇవ్వాలా, ఏమి ఇవ్వాలి కీటకనోజోల్లో should be mentioned. So that is the instruction given to the pharmacist by a physician. Which dosage form should be prescribed? Okay, olden days లో dosage, old prescriptions లో subscription అంటే it is method, procedure of preparing the dosage form. Okay, so instructions given to the, yeah, instructions given to the pharmacist for dispensing, number of doses, how many tablets to be given, right? How many days daily, right? So 15 days, 10 days, all those things are mentioned there. And instructions given to the patient, right? How to use the medicine before meal, after meal, or what, right? This comes under superscription. Okay, even superscription tarvata, ikkada in this thing they haven't mentioned the signature. Signature lo, yeah, ఇచ్చారు కదా signature, very good. Signature కూడా ఉంది. So inscription, superscription, subscription. Superscription is the RX, already mentioned here. See, you can see నేను ఇందాక చెప్పాను, right? Superscription is the symbol RX, traditional symbol, right? Which always written before the prescription. It is derived from the Latin word recipe, already be taken. It means to be taken, right? Inscription no, name of the drug in modern prescription, quantity of the drug, how much mg you are giving, dosage form of the drug, right? Whether it should be tablet, capsule, suspension, all these things should be mentioned, right? Then we have the signatura. Signatura lo emuntundi, or transcription lo instruction given to the patient how to take the formulation. That is the signatura. Okay. So instructions given to the patient is signatura. Please write down superscription, subscription, inscription. Superscription is an RX to be taken onto the inscription lo. Inscription lo you contain the number of the ingredients, name of the tablets, right, or all those details. Then subscription, in subscription lo you have instructions given to the pharmacist, and in signature you have the instructions to be given to the patient, right? Into the route of administration, ఎలా వాడాలి, how to dilute the drug, how to take the drug, right? How to dissolve it, whether in the water or milk, how to take tablespoon, teaspoon, right? How many times should you take, what is the frequency of the drug? All these details comes under signature. Clear?
Yes, sir.
Yeah. So even duration of the dose, chepunam, purpose of the medication, all the instructions given to the warning, right? Even given check well before use an instruction, all these things comes under signature. Then the next important part of the prescription is refilling instructions, right? When to refill it, when to repeat this drug, whether it is supposed to refill or no need to refill. Idanta comes under refilling instruction. So depending on the disease condition, depending on the like nature of the drug and other symptoms of the patient, doctor will decide whether to refill the prescription or not. It's not the duty of the pharmacist to refill the prescription. Okay. Next, signature, address of a registered pharmacist. So, who is the registered physician who is writing this prescription? What is his license number? Where is his address, his phone number, and all other details are mentioned here. Okay, you can see the example of the prescription and you can find out whether all the parts are mentioned or not. So doctor's name, disqualification, everything ఇక్కడ ఉంటుంది. Then registration number of the doctor, allopathia, homeopathia, name, email address, everything. Then our part started. Name of the prescription, name on the prescription, date of the prescription, name of the patient, then address, age, gender, weight and చెప్పుకున్నాం మనం, right? దాని తర్వాత this part is superscription, right? ఇదేంటి నాన్న? Superscription, right? Name of the medicine, strength, dose. What is this? Name of the medicine? Inscription, right? Then strength, dose, instruction. This is subscription. Subscription. Then what is there? Other details are missing here. Signature is missing. Refilling instructions. When to be refill and raste. Come back after these many days and raste. Right? 1 week తర్వాత చూపెట్టుకోండి doctor చెప్తే the refilling instructions. Okay? What to do, what not to do is given to the instructions given to the patient are called signature. Okay? So this is about the prescription. Now I hope you know, like this is just a brief revision for all the things you have studied in past. After parts of the prescription, the next major thing to be discussed is handling of the prescription. How to handle the prescription is very important. And so while handling the prescription, how to receive it, how to read it, how to check it, right? How to collect and weigh all the material, how to compound the material, even how to maintain your facial expression is also very important. So please write down handling the receiving, reading and checking, collecting and weighing the material, compounding, labeling, and packing. These are the handling steps in the prescription. Yes, noted. So receiving. How to receive the prescription? The prescription should be received by the pharmacist himself or herself. While receiving the prescription from the patient, pharmacist should not change his facial expression, right? And should not keep the expression like he's confused, he was shocked, he was surprised by seeing the patient condition. Example, cancer patient వచ్చింది diagnosed అయ్యి వాడిని చూసిన facial expression అని పెట్టినావు అనుకో వాడిని expression కే చచ్చిపోతాడు. So you should keep your expressions neutral. You shouldn't express anything. నీకు అర్థం కావట్లేదు డాక్టర్ రైటింగ్ లోపల పోయి డాక్టర్ని అడుగు, అంతేగాని ఇదేం వీడు పిచ్చి పిచ్చి రాసిందని వాళ్ళ ముందు మాట్లాడడం, వాళ్ళకి నీకు అర్థం కాలేదని వాళ్ళకి తెలియడము, ఇలాంటివన్నీ చేయకూడదు. సో అండ్ అక్కడ పెట్టండి అని చెప్పొద్దు. ఫార్మసిస్ట్ షుడ్ రిసీవ్ బై హిమ్సెల్ఫ్, బై హిస్ హ్యాండ్. సో దిస్ ఇస్ వెరీ ఇంపార్టెంట్ అండ్ హీ షుడెంట్ చేంజ్ ఎనీ ఆఫ్ హిస్ ఫేషియల్ ఎక్స్ప్రెషన్ వాట్ ఎవర్ యూ అండర్స్టాండ్ ఇన్ ప్రిస్క్రిప్షన్ డిపెండింగ్ ఆన్ ద situation of the patient or symptom of the patient, right? Next, findings of the patient. Reading and checking. Proper ga read cheyali. So writing should be legible, right? It should be completely correct ga unda leda. Any confusion unnaya anedi check చేసుకోవాలి, because many times misspellings will be there, like prednisone, prednisolone, right? Like that, many drugs are there which will sound similar, which will spell similar, which will look similar. So reading and checking once and twice is very important. First 2 times you will read, first number 3 times. First you will read it before like dispensing the drug to check what drug is there. Second, you will carry that prescription to the shelf where the drug is stored. Take the drug, read it again, compare it both on the prescription and on the label, then keep on the table. Third thing, after gathering all the drugs, when you come at the billing, you bill it, and when you're giving to the patient, again check the prescription and the drug whether you're giving the same drug which is given in the prescription. So reading and checking at least 3 to 4 times is very, very, very important. Then about the legality, prescription is legal when it is written by registered medical practitioners. It should be signed by ఇక్కడ ఆర్ఎంపీ అంటే మన ఆర్ఎంపీ అని కాదు. ఆర్ఎంపీ అంటే ఇక్కడ ఫిజిషియన్స్ అని అర్థం అండి. It has also information required to contain with respect to the part of the prescription. Parts of prescriptions అన్ని ఉండాలి. రిజిస్టర్డ్ ప్రిస్క్రైబర్ ఫిజిషియన్ యొక్క సిగ్నేచర్ కూడా ఉండాలి. నేను రీడ్ చేసేటప్పుడు ఇవన్నీ చెక్ చేసుకోవాలి మీరు ఉందా లేదా. లెజిబిలిటీ, రైట్, ప్రాపర్ గా కనిపిస్తుందా లేదా. లెజిబుల్, ఇస్ దర్ ఎనీ ప్రాబ్లమ్, రైట్, ఇస్ దర్ ఎనీ అలర్ట్నెస్ రిక్వైర్డ్, క్రిటికల్ జడ్జ్మెంట్ ఏమైనా తీసుకునేది ఉందా, రైట్, అబౌట్ ద ప్రిస్క్రిప్షన్. ఎనీ కేర్లెస్ హ్యాండ్ రైటింగ్ వల్ల నీకు డౌట్ వస్తుందా, ఏమైనా స్పెల్లింగ్స్ వల్ల కన్ఫ్యూజ్ అవుతున్నావా చెక్ చేసుకోవాలి. Because there are a lot of drugs with the similar sounding like prednisone, prednisolone, digoxin, digitoxin. So ilanti can cause ambiguity and confusion. So you should be careful in such cases. Then completeness and the correctness. So the prescription serves as a vehicle for the communication by the licensed prescriber to a pharmacist. So complete and correct information should be there. All the details of the patient, product, and physician details should be there. If not there, incomplete description is there, then it should be fulfilled. Then collecting and weighing material is the third important part of the handling of the prescription. Ela collect cheyali, ela weigh cheyali is very important, right? So before compounding the prescription, all the material required should be collected from the shelf and drawers and kept on the left hand side of the balance. It is important. So balance ki left hand side weigh చెయ్యని సబ్స్టాన్సెస్ పెట్టుకోవాలి. దాని తర్వాత బ్యాలెన్స్ మీద వే చేసుకోవాలి. మనం వే చేసుకున్న ప్రతి సబ్స్టాన్స్ యూ విల్ కీప్ అట్ రైట్ హ్యాండ్ సైడ్, రైట్ హ్యాండ్ సైడ్, right, so that you can check whether this particular ingredient is weighed or not. So our difference you should have known. Okay, so before compounding, should collect all the material, keep on the left hand side. After measuring, each material should be kept on the right hand side of the balance. After compounding the prescription, the material are replaced, closed and replaced on the shelves, drawers from where they are collected. So 3 times you should read the label. It is very, very important. Eppudu one, when collecting the material from the shelf or drawer, you should check the label. 2, when the material are measured. 3, when this material is replaced in the shelf, మనం కరెక్ట్ సబ్స్టాన్సే ఇస్తున్నామా అనేది 3 times చెక్ చేసుకోవాలి. కలెక్టింగ్ అండ్ వేయింగ్, వెరీ ఇంపార్టెంట్ పార్ట్. వేయింగ్ బై డిఫరెన్స్ అని కూడా ఉంటుందండి. You should know that also. If any viscous substance is there, if there are liquid is there, then exactly weighing them is a problem. So you should weigh by difference. Weigh by difference అంటే 5 ml ఎగ్జాక్ట్ మెజర్ చేసుకోవాలి అంటే మెజరింగ్ సిలిండర్ నుంచి 5 ml స్టిక్కీ సబ్స్టెన్స్ బయటికి రాదు. సో నువ్వు 7-8 ml తీసుకొని అందులోంచి 5 ml ట్రాన్స్ఫర్ చేస్తావు. సో దట్ ఇఫ్ యు ఆర్ వెయిటింగ్ అంటిల్ లాస్ట్ డ్రాప్ టు బి ట్రాన్స్ఫర్డ్, లక్కీలీ maybe they will stick to the walls of that measuring cylinder. So weighing by difference is also very, very important. Last part of handling of prescription is compounding properly, preparing a proper label with all sufficient information required, and packing it, storing it in a suitable container. So only one prescription should be handled at one time. This should be the rule. 4 ముందు పెట్టుకొని ఇందులో ఒకటి అందులో ఒకటి అందులో ఒకటి ఇచ్చుకుంటూ వెళ్ళొద్దు. ఒక్క ప్రిస్క్రిప్షన్ అయిపోయినాకే ఇంకో ప్రిస్క్రిప్షన్ ముట్టుకోవాలి. దట్స్ వెరీ, వెరీ ఇంపార్టెంట్. Compounding should be done on the clean table only. All equipment required should be clean and dried, and the preparation should be prepared according to the direction of the prescriber and as per the method present in the pharmacopoeia. You should not change the steps. You should not